Quick disclaimer before you listen. The World's Okayest Medic Podcast is an educational and commentary platform produced and recorded by me. What we say on here is not endorsed by any of our employers, and we are not speaking on behalf of our employers. Our commentary is our own. Finally, remember to follow your local protocols.
Of course, as soon as I start recording, they come to mow the lawn. The first cut of the spring up here. I hope you don't hear the lawnmower, but if you hear the lawnmower going, I apologize. Like you, I am a busy person. I've got to go to work tonight. It's Friday night flight shift, and I'm kind of pressed for time. One of the kids is homesick from school, so here we are busy. So if you hear the lawnmower, I apologize. Real quick, if you don't subscribe to the Patreon, I would really appreciate if you do. It's $3 a month. That's it. Pretty cheap, but it greatly helps me with putting out content, paying for the platforms and stuff, and supporting the podcast in general. $3 a month. It is, I can't tell you how helpful it is. So if you can't, no sweat. But if you can, the Patreon account link is in my bio on the Instagram. And for YouTube watchers, here it is on the screen. Also, I am now an affiliate with Frontline Optics and with X-Shears. I love both products. I use them both at work. So at Frontline Optics and at X-Shears, you can use code OKMedic, OKMEDIC at checkout for a nice discount. And that also helps to support the podcast. But let's get into the content today. I am working on some other content. Here comes the lawnmower. I am working on some other content. I'm working on an episode on complacency and mindset that I think is going to be pretty good. I was going to work on that today, but I decided to answer this question about the FPC exam because selfishly, and this is no exaggeration, I get asked this question at least daily. I got asked it this morning, and I'm kind of tired of typing out an answer every time. And that's not me bitching to you people, the listeners. I love you all. It's just, I really need like a prefab answer for this question because I get it all the time. So this way I can just send a link to the podcast episode and be like, hey, bud, thanks for messaging me. Check out this episode. Also, as an aside, for the nurses, the beautiful nurses, I love nurses. This stuff that I'm going to talk about in this episode applies to the CFRN and the CTRN as well. Now, yes, I am not a nurse. I am just a feeble medic. I do not have the CFRN or CTRN certifications, and I've never obtained them. I've never taken the test. But I did work for a few years teaching the flight medical provider course, which is a prep course for both the medic and nursing versions of these certification exams. They're extremely similar exams, and the content outlines are almost identical. I also have feedback from both people who have taken the CFRN and CTRN, and what they report very closely mirrors what is on and how they ask questions on the FPC and CCP-C exams. Also, just because somebody will ask, I am not going to cover the TPC or CPC on this. I know CCP-C, CPC. What is it? The CPC, you sound like a Scientologist here with all the acronyms, but the CPC is the community paramedic exam. I don't even think you need to study for it. I took it way back. I let the certification lapse. I think they can use it as a cognitive test for people with dementia. I think that my construction industry cost manager brother could walk in and take the CPC exam and pass it with flying colors. That test is a joke, in my opinion. But the FPC and CCP-C exams are not jokes. They are quite challenging, and that's what we are going to talk about today. As far as medicine and non-flight EMS operations, the CCP-C and the FPC are the same test, and they are equally as difficult. Both are very challenging exams. I have taken both. I have had both certifications. I let my CCP-C lapse. Personally, I don't see the utility in having both the FPC and CCP-C and spending all of that money. Nevertheless, both are very challenging tests. They're good certifications to have. Personally, I recommend just getting the FPC exam because I've heard people say before, I want to get the CCP-C because I have no desire to ever fly. And then 3 or 4 years later, after doing ground critical care transport, they're applying for flight teams. And while both certifications have the same weight, same merit,
Some teams do want the FPC, so now they're trying to take the FPC again. I would just say, F it, get the FPC. But I only have the FPC. I let the CCP-C lapse. Both tests, so while challenging, they are extremely fair tests, in my opinion. Now, my opinion is that they are well written and they ask questions in a way that is indeed quite challenging, but it's not in a gotcha overall technical, deceptive, unfair way. And it's also not what I hear the NCLEX is like, which is, we're going to provide you with 4 absolutely correct answers. Which one is the one that we think is the best? I don't think that the FPC exam is like that. I do think it is very fair. Also, when I talk, I'm going to use the verbiage FPC because that's the most common one that I find that people take. The test that I'm used to talking about is the FPC. I'm just going to say it because it rolls off my tongue. It all applies to the CCP-C and the nursing tests. I don't feel like going through the entire podcast saying FPC or CCP-C and also the nursing tests. So I'm just saying FPC. What I'm going to tell you all applies, to reiterate, to the CCP-C as well. They are the same test, just the CCP-C does not have any questions about flight physiology or flight operations. They make up for it with more clinical questions and more ground operations. Okay, first, so let's get to it. Don't take the exam if you don't have some foundation of the knowledge. We can debate all day long whether there is any point for the 911 medic who doesn't want to do critical care transport to take the exam or have the certification just to have it. That's a discussion we can have. But the fact of the matter is that if you don't have some foundation of what is on the exam, either through experience or through a prep course, when I tested, I had no experience. I'd just been hired to do critical care transport. I did my orientation and a prep course. I had never been on a critical care ambulance before. I took the CCP exam and I passed it. A year later, I took the FPC and I passed that. So I would recommend doing a prep course because I can tell you, I didn't know shit when I went into it and I would have failed miserably. Unless you have that foundation of knowledge, you are likely to fail miserably because even the best trained and the most competent of 911 paramedics do not have much of the knowledge that is on that exam. Regular paramedics are not taught anything about pulmonary artery catheters, what it means if a wedge pressure is elevated, how counterpulsation affects aortic function, or why the foramen of Monroe is important, and what it means if P2 is greater than P1 in an ICP waveform, and what you're supposed to do about it, and whether you should use mannitol or hypertonic saline. Spoiler alert, doesn't matter. It also, if you don't know these things, it doesn't mean you're stupid or that you're a failure. You're just not taught these things in your regular scope of practice and in your initial paramedic training. So how are you supposed to know the answers to these questions? You don't have exposure to the material. And the same goes for nurses. You could be the greatest ICU nurse or ER nurse in the world, but unless you're also a paramedic or have a ton of other EMS experience, you likely know absolutely nothing about EMS operations, radios, disaster triage and management, MCI operations, stuff like that. When I would teach the prep course, medics would panic about lab values because we just aren't taught lab values in our initial training, and we really don't use them on the street. And now I will invariably get a DM from someone excoriating me and saying, our medical director wants us to do a basic metabolic panel on every patient, and they will open up ICU beds if we pre-alert them with abnormal lab findings. Yeah. But we don't learn lab values generally. We learn some, but not all of them. And the flip side is true for nurses. You know what panics nurses who are taking the class? 12-lead EKGs. Why? Because nurses are stupid. No, I'm totally joking. I'm kidding. Not at all. It's the same thing as the medics not knowing the lab values. The lab values are like etched into the brains of the nurses, but not the medics. And that's how 12-lead is with the nurses. Nurses are not taught 12 leads in nursing school. In fact, my wife, who is a nurse practitioner, will tell you that her 12-lead training in nurse practitioner school was a 3-hour lecture on 12 leads. So nurses just don't have that knowledge. So there are, in these prep courses, there are gaps in knowledge that are filled in each respective scope. This also speaks to why the nurse-medic combo on critical care transport units works so well, because experienced nurses know the nursing stuff, experienced medic knows the medic stuff. Here comes the weed whacker. You train them both to the same protocol set and expectations, and on a complex patient, you put the brains and the skill sets together, and it's a beautiful combination of experience and common yet separate knowledge bases. So, went down a rabbit hole. Unless you already have a lot of exposure and knowledge around critical care transport, take a review class. You probably should take a review class anyway, even if you have all this knowledge. As you know, I used to teach for Impact EMS. I don't work for them anymore. I am an unaffiliated bastard now. They do have a good class, and I should know because Gwenny and I rewrote the entire thing. My friend Cody, who's Ordinary Ops Medic on Instagram, he teaches for Flight Bridge Ed. I've seen him teach. He's a great instructor. They have a great product. Foam Frat has a great product too. There's all kinds of products out there. I recerted my FPC using Flight Crit a few years ago. I did my initial training back in 2013 with Anthony Baca's crash course. I think that's still around. So the IBSC or I think it's IBSC. I always flip the middle two letters around. The IBSC has a list of them. So go to their website and pick one and take it so you get exposure to what is on the exam and what you should study. The exam is not all of this hardcore critical care stuff. A good chunk of it is straightforward, simple paramedicing. There were questions about laryngoscopy, treating MIs, treating shock. This is easy bread and butter medic shit that you already know. So while yes, the test is very challenging, there are a fair share of simple questions with easy answers, and you're taking them and you're thinking, really? Let's move on to study material. What to say about study material? I get asked all the time what books and websites I recommend to study. I did a YouTube on this a couple of years ago when I was not as smooth at the content creation and 60 pounds heavier, but I will give you the updated list here. Books. Everybody wants the books. First, my good friend Gwenny wrote a book called But Why. It is a test prep book with review questions and rationales for why the correct answers are correct and why the incorrect answers are incorrect. It is an excellent book. How do I know it's excellent? Because I reviewed it and I red teamed it for her before she published it. Really is a great book that she should be very proud of. I'm very proud of her for it. I'm glad she's had a lot of success with it. And I have had more than a few students who got it sing praises for it and say that it really helped them pass the exam. I used a book back when I took my tests, and I still recommend it. It's called Back to Basics by Orchid Lee Lopez. I don't know her, but kudos to her. She did write a good book. It is kind of the same thing as Gwenny's book as far as providing rationales and test questions and why such was right, such was wrong. It is much longer and goes into a lot of detail. I'm not saying Gwenny's book doesn't. Gwenny's book is quite thick. I think here it's like 200 and something in the teens pages. But Back to Basics is a long book. I would recommend getting it. I think it's like $25 on Amazon. Keep in mind that while I did say it is longer, it is not as up to date as Gwenny's book. The material is still very good, but Gwenny's book is much more up to date. I mean, I used Back to Basics to study for my CCP-C in 2013, and I don't think it's been updated since then. So I would get both. And if it has been updated since then, I apologize. Let me know, and I will correct it on the podcast. But I don't think it has. Other recommendations. The lovely Melody Bishop RT wrote a free online ventilator book. It's called Basic Principles of Mechanical Ventilation. Don't ask me to drop a link. Google it plus Melody Bishop and you will find it. I also recommend the following 3 books to everyone, whether they are taking the class or they want to take the FPC or not. In fact, I keep these books in my backpack that I bring to work, and I reference them constantly on clinical issues and when I'm doing content. And I would definitely get them if you're planning on taking these tests. They are The Ventilator Book by William Owens, the ICU Survival Book, also by William Owens, and The Vasopressor and Inotrope Handbook by Dr. Eddie Gutierrez, who you should follow on Instagram. He's a nice guy. I met him. I had a beer with him at Resus X. Great guy, smart guy, great teacher, and he wrote a great book. It's not just pharm. It goes into a lot of the shock physiology, receptors, etc. Info you're going to need to understand to pass the exam and then be a good critical care transport provider. And I think paramedic in general. As far as websites, I don't have a whole lot. Like, yes, Critical Care Now, Life in the Fast Lane, EM Docs, Rebel EM. Those are blogs that I go to as references all the time. Let me take a sip of coffee here. But as far as prep websites, there's a site to practice ABGs that I would definitely use. It's called abg.ninja. So go there, bang out the ABGs. And abg.ninja also has a site now to practice hemodynamics, which you certainly will get a lot of on the exam. They do like to provide you with a lot of hemodynamic values like a cardiac index and systemic vascular resistance and central venous pressure. They'll give you those numbers. Then they'll ask you, hey, what kind of shock is this patient in? Or they'll give you the numbers and they'll say, hey, what's your treatment for this patient? So you can practice that on abg.ninja as well. All right, so you're prepared. You go in the day of the exam. How do you pass the test? Keep in mind that it's just basic test taking strategy, but I will talk about the FPC specifically, because this is a podcast on that. First and foremost, for the love of Pete, do not go back and change your answers. Neuroscience and test taking educational studies have shown that your first inkling is generally the right answer. If you go back and change it, you're going to fuck things up. I mean, read and reread before you click submit for your answer. And before you click submit, read the question and your answer again. I've had to train myself to do this because I take tests very quickly, and I am notorious for reading too quickly and missing a not or a but or a does not. So don't screw up by something stupid like that. Proofread your answer, but unless you find something so totally obvious that you got wrong that makes you go, oh, duh, I can't believe I clicked that. I'm glad I proofread it. What an idiot. Don't change your answer. Be confident. Your first inkling is usually the right answer. I hear time and again from people who fail tests that they went back and they changed their answers. They're really not trying to trick you or deceive you when they write the test. I remember getting an EKG question on my FPC exam. It was a simple inferior wall MI with tombstones in 2-3 and AVF. Now, my moles tell me that they're now putting an EKG that shows a lateral wall MI on the FPC, but back then it was a clear-cut inferior wall MI, and the answer was inferior wall MI. It was that simple. I clicked inferior wall and I hit next because that was the correct answer. There was none of this, oh, that was too easy. They have to be asking about something else because that was too obvious. And then you start staring at the EKG, looking for some tiny little other non-existent, inconsequential thing like, oh, well, there actually is a right axis deviation. Maybe they're asking about that. So maybe it's like in a PE, but that's not an answer. So maybe just no. Your first inkling is the correct answer. If you see the answer and it's obvious, that is it. If you hear hoofbeats, think horses, not zebras. Now, here's where they do trip you up. Nevertheless, they're not deceiving you. They're definitely challenging you to make sure you know your shit, but they aren't lying to you and they're not trying to screw you over. What they're doing is actually preparing you because this is how it is often on critical care transports, especially complex ones. They will provide you with a scenario and with tons and tons of data. You then have to pick out what is the big problem. What is the most immediate problem, and what are you going to do about it? So I remember getting a question that was something like, you are called to a small community hospital to transport a 52-year-old female who fell down a ravine while hiking. She arrived hypothermic with a core temp of 94 Fahrenheit. Injuries are a left femur fracture that has been reduced and is in a traction splint. She's got a left-sided flail chest with a pneumothorax. She's got chest tube in place, water seal, blah, blah, blah. CT head shows a trace subdural hematoma. GCS is 15. She's getting fentanyl Q 30 minutes for pain. She has a cardiac history. Her troponin was less than 0.04. Sodium was 145. Glucose 215. Hemoglobin 10. Lactate 3.1. Potassium 9.5. And boom, there's the answer right there. That's what they are asking about. A potassium of 9.5 is like death high. They gave you all of this data, some of it meaningful, some of it totally inconsequential. But the big, bad, eye-popping thing that made you go, oh shit, was the potassium. That's going to kill her now. So if you go to the A, B, C, D of answers and you see that one that pertains to treating hyperkalemia, that's what the answer is going to be. That's the type of question you're going to get. They will then also ask a follow-up question. So you hit submit for your answer to that question, and then you'll get something like, of these 4 EKGs, which is most likely to demonstrate effects of the condition that the patient was experiencing in the previous question? Challenging, but certainly fair. What else can I say? When you take your prep course and when you're studying, if there is a sign, know it. Like Cullen sign, Gray Turner sign, Brzezinski sign, know them. They love to ask about signs. I think Gwenny calls them dead doctor signs. So write them down, make flashcards. They also like to ask about triads. So any triad, Cushing's triad, Beck's, the triad of preeclampsia, Waddell's, know the triads. So let's wrap this up. Quick podcast. Some other totally random shit to finish this off just from intelligence reports that I have received. I would know urine output for kids, know the different types of spinal cord injuries like central cord syndrome, anterior cord syndrome, Brown-Séquard syndrome, know what syndrome of inappropriate antidiuretic hormone is and what to do about it. And they have added some POCUS stuff to the exam. It wasn't on there when I took it, but I'm an old man now. But I'm told it's not too much. And I am told from people who have taken the test that it is a question about a fast exam. I would also know how to identify a pneumothorax using POCUS. Please know ARDS-NET vent strategy and vent strategy for patients with status asthmaticus. Know how to calculate a pediatric ET tube size and depth. Know the difference between croup and epiglottitis, steeple sign, thumbprint sign. Know simplex versus duplex radio. And I'd refresh yourself on aortic dissection. Luckily for you, I did a podcast on the treatment and pathology of aortic dissections. So listen to that. And that, people, is what I've got for as far as how to prep for the FPC exam. Like so many other episodes, I wasn't planning on doing this one, but I've gotten so many questions on this that I just said, screw it, and I put this together. I hope this helps. I love you all. Talk to you soon.